You're looking at some of the first people in Windsor-Essex to receive the COVID-19 vaccine. A monumental day, but it comes as cases continue to rise and more people die. Long-term care and retirement homes continue to struggle with active outbreaks. 8 people have died at the village at St. Clair, and CBC News found reports showing the home was dealing with multiple issues even before the second wave. Bit cloudy out there tonight as we take a live look at the Ambassador Bridge. Rough day wind-wise as well. People along the Lake Erie shoreline being warned about potential flooding. Nick Sirkovich joins us tonight with a full look at the forecast. I'm Chris Ensing. Thanks for joining us. Vaccination Day in Windsor, a historic moment as the area passes milestones in COVID-19 cases and deaths. This morning, the health unit says 213 more people have tested positive for COVID-19. 4 more people have died. That's more than 6,000 total cases, more than 100 deaths. All of the deaths were people living in the community. 3 were men in their 70s, 1 a man in his 80s. And we have 1,186 active cases in Windsor-Essex today. It took Windsor-Essex 10 days to get from 4,000 to 5,000 cases. It took less than a week to hit 6,000 cases from 5,000 as we look at the total case count in Windsor-Essex. But today, there's a glimmer of hope. The first doses of the COVID-19 vaccine administered this morning in Windsor-Essex. Staff at long-term care and retirement homes first in line. People who have personally experienced the brutal realities of COVID-19. CBC's Katerina Georgieva reports.
The very first shot, a shot of hope, offering a chance at getting to the end of the pandemic. First in line, Crystal Malash.
It's actually a little overwhelming.
A personal support worker at a retirement home. She's on the front lines, but COVID hits painfully close to home. Her father, George, became sick with the virus in the spring. He spent 16 days on a ventilator and died June 19th. The family had to say goodbye through an iPad screen.
Seeing how quickly he deteriorated, I do not want anyone, to ever experience what we have. And I know that right now that he is with me right now, and I know that he's very proud of this.
Malash was one of 7 this morning, the first group to get the shot. They're among 130 vaccinated today. In total, this first batch will be able to get to just under 2,000 people in the region. This registered practical nurse understands COVID firsthand. She works at Amica Riverside, a home that was in outbreak in the spring. Both she and her husband caught the virus. She says the vaccine is a gift.
Actually, I cried. I was so thrilled. I feel very fortunate to have the opportunity.
Vaccinations will continue over the next week or so at the Sportsplex building behind me. It's not clear yet, though, when the next shipment of the vaccine is expected for our region. The CEO of Windsor Regional Hospital says that this is the beginning of the end, but we are not out of the woods yet. And he says that the next few months are going to be the most difficult months in the pandemic. Malash says the vaccine is a chance for people to protect themselves and their loved ones. She hopes others will be spared the pain her family and her father endured.
He was a wonderful man, and he deserves all the credit for every fight that he went through this year, and he's the reason why I'm here today.
He would have turned 74 last week. Katerina Georgieva, CBC News, Windsor.
Now, those videos there of people getting the first shot's a welcome sight, but some perspective here. You heard Kat say about 130 people will get a vaccination shot today. There were 213 new cases this morning. For the average person who's not part of a priority group, the health unit says the vaccine may start to become available in early spring. That's months away. Now, the top priority groups are people who live and work at long-term care or retirement homes, healthcare workers, adults in Indigenous communities, and those who receive regular home health care. Windsor-Essex has one of the highest rates of COVID-19 infections in Ontario, but it didn't make a list of communities about to split millions of dollars from the province. With more, I'm joined now live by the CBC's Sanjay Maru. Sanjay, where is this money going exactly?
Well, Chris, about $54 million is being made available for communities that the province has marked as being more diverse than others in terms of income and race. Now, the province says it's these communities that have been impacted by COVID-19 more significantly than others, and this money would be used primarily for things like creating more isolation facilities and also for providing greater access to testing. Now, these are the 15 communities where the province will allocate this funding. You can see many of these communities in the GTA. Windsor-Essex, nowhere to be found. And we talk about hardest hit. Take a look at this. These are the new cases reported daily in the region for every day this month. Triple digits for the last 9 straight days, including a record high just 5 days ago. Now, these are indicators that the chair for the local Board of Health is pointing to as reasons why today he's shocked and disappointed.
If you look at per capita, we're right now we're ahead of the York region and part of the GTA. So we're about number 3 in the province. Our long-term care facilities are being hit quite hard, and the agri-food industry as well. Is we went through this in the spring. I don't think there's another region in the province that where we host anywhere between 8,000 to 10,000 guests.
So, Sanjay, why was Windsor-Essex left off of that list there?
Well, Chris, I reached out to the province today with that very question. Here's what a spokesperson tells me. He says the government has identified priority communities based on COVID-19 case numbers, as well as persistently high testing positivity values and low testing rates and socioeconomic factors. As case numbers and testing needs evolve, the government continues to monitor trends across regions and communities to identify additional priority communities as needed. Now, I immediately responded back to again ask why Windsor-Essex wasn't considered one of those priority communities from the get-go, but was told I would not be getting a response back today. Now, I also spoke with Windsor West MPP Lisa Gretzky. She says it's absurd that the province wouldn't deem any community in Windsor-Essex as high priority, and adds her riding should be among the most obvious communities to receive this funding.
If you look at just the demographic of my riding specifically, just Windsor West, you tend to see a larger population, especially West End and downtown, of lower income people, people that are in dire need of more support. They are more vulnerable than some of us, myself included, that have a steady income and a roof over our head and can put food on the table. They are at more risk of contracting COVID-19 and spreading that throughout their connections.
I also reached out to Windsor Mayor Drew Dilkens. He says he's not too concerned about Windsor-Essex being left out. He instead pointed to previous funding that Windsor-Essex has received from the province. Meanwhile, the Ontario government says it would consider adding Windsor-Essex on the list at a later date. No word, however, on when that might be. Chris.
Thanks, Sanjay. The CBC's Sanjay Maru live tonight. There's 14 long-term care and retirement homes in outbreak right now. The village at St. Clair has been dealing with a large COVID-19 outbreak for the last 2 weeks. This outbreak now has more cases than any other home in Windsor-Essex. That's including outbreaks during the first wave. The village at St. Clair has 147 COVID-19 cases among staff and residents. 8 people who lived at the home have died after testing positive for COVID-19. Inspection reports show the home's been struggling with inadequate staffing and neglect even before the latest wave of the pandemic struck. CBC's Jennifer LaGrasse has been looking into the home's inspection reports. Jen, what did you find out?
Chris, those public inspection reports from the village at St. Clair show that the home has a number of serious violations relating to low staffing levels, improper care, and resident neglect. When we look at this year, we see that there was 5 critical incident inspections, 4 complaint inspections. Last year, 6 critical incident inspections, 4 complaint inspections. In total, at least 20 infractions. When we look at a report from late October, we see that the home was not fully staffed, leading to improper care of residents. It had a contingency plan to get agency PSWs as a last resort, but the general manager says that it did not do that, even though it was failing to protect residents and provide proper care to them. Another report found that in July, there was resident neglect and improper care. And in March of last year, the home was actually ordered to improve its infection control practices, as it was found that it wasn't properly monitoring or documenting resident symptoms related to an illness. A long-term care advocate that I spoke with says that these reports raise concerns about the home even prior to the pandemic.
It's very clear reading these inspection reports that this home has had issues for a long time. There is a pattern of compromised care, and the pandemic only aggravated what clearly is a disorganized and fragmented home. I haven't reviewed all of the home's inspection reports, but this looks like more than the average home receives. So we know that inspections have been largely, halted over the course of the pandemic, yet there have been several over the course of the pandemic for this specific home, which means the family have been very aggressive in demanding that these critical incident inspections occur.
It's an interesting point there. Why might the home be seeing this increase in inspections?
Well, Chris, over the last few years, the government has been ramping down this unannounced inspection it does, known as an RQI, or Resident Quality Inspection. This is something that essentially looks at all different aspects of the home, so infection control measures to quality living. An expert I spoke with said this is likely part of the problem here, as the last time this home had an RQI was in 2018. After that, you see those critical incidents and those complaint inspections spike.
One of the challenges that we see is that, over the last few years, like this is a classic home where we're seeing the number of kind of individual complaints skyrocket in the 2 years after you're actually, not receiving an RQI anymore. And the argument might be that actually, if you actually were continuing to do these RQIs, you might not have all these other, a significant increase like in the number of other critical incidents and other complaint inspections occurring.
Now, Jim, what's the home saying about all of this?
So the village at St. Clair got back to me with a statement which in part reads, in response to an inspection report in February 2019, where the ministry identified room for improvement on infection control assessments, we created an electronic surveillance record protocol that has now been rolled out in all of our homes. In terms of staffing, the village at St. Clair was fully staffed prior to the pandemic. With the current outbreak at the home, we are working to increase our staffing levels. The efforts from our dedicated central recruiting team, from our support office, continues to yield new hires, including a nurse practitioner and the onboarding of nurses and PSWs from our agency partners. Chris, the home continued to say that it's sending in staff from other locations, and it is also running weekly virtual recruitment fairs to get more staff. Meanwhile, the Ministry of Long-Term Care says that it has sent in physicians and other agency staff, and Hotel Dieu Grace Healthcare Hospital has sent a team in as well. Chris.
Thanks for this, Jen. The CBC's Jennifer LaGrassa for us tonight. Now, today, the national head of Unifor, Jerry Dias, urged the government to act immediately, saying that the situation is a matter of life or death. At a statement today, he said the government has resources at its disposal for emergencies like this, including the armed forces or the Red Cross. Something must be done immediately before a terrible situation gets even worse. Now, you can read more on this story at our website, cbc.ca/Windsor. Since it was published, we've learned that the Ministry of Long-Term Care did an on-site inspection today. The ministry says that the decision on, quote, alternative management support is made on a case-by-case basis. A migrant worker who just recovered from COVID-19 is on his way home tonight. But before he left, he spoke with CBC's Jacob Barker about how difficult this year has been working at a farm in Windsor-Essex. A note, CBC News has decided to respect the worker's request for anonymity as it could affect his employment.
A call from the Red Cross, one of several this worker says he gets every day. The worker tested positive for COVID-19 on December 3rd, a few days after he first felt sick. At first, he was put up in a hotel in Leamington by the company where he says he was left alone with no help.
I didn't feel well. I was sad and I was nervous. I know people have died because of this, and I was praying to God that that wouldn't happen to me. My family was worried.
He was moved to this hotel in Windsor after he reached out to the UFCW, a union that advocates for migrant workers. When we spoke with him, he says he was there along with 9 others from AMCO, a majority of whom had tested positive. The UFCW says many of the workers at the greenhouse facility have been quarantined, but neither the health unit nor the company has confirmed an outbreak at the facility. The worker says he did experience symptoms of COVID-19. His whole body hurt, he couldn't walk well, he lost his sense of taste and smell, and had a fever.
I didn't even eat. I would leave most of my food. I went to bed and stayed there. I didn't want to eat, and I wasn't even drinking water.
The worker from Guatemala has been with AMCO for the last 2 years. He was supposed to fly home to see his family on Christmas, December 14th, but the positive COVID test kept him in isolation.
I want to be home for the 24th and the 25th, and I don't know if I'll be there.
He says there were measures put in place to stem the spread of COVID-19 at the facility in the spring. Workers were kept from leaving except to buy groceries, and the number of people staying at his bunkhouse were cut in half. But after a couple of months, he says some started going into town without wearing masks. He and others complained about 2 co-workers who weren't following the rules. He says his supervisors didn't do anything.
And when I tested positive, I started to cry and asked, why me, if I protected myself?
Well, we did reach out to AMCO Produce several times to address the concerns that the worker had, but it did not respond. The UFCW says that since we spoke with the worker last week, he did get a ticket to go back home. He was scheduled to leave this morning from Toronto to Guatemala and be home in time for Christmas. Jacob Barker, CBC News, Leamington.
There's been a big focus on outbreaks at farms in our region. If you remember the summer, it was something we were reporting on extensively. I had a year-end interview with Dr. Wajid Ahmed. He's the medical officer of health for the Windsor-Essex County Health Unit. We hear from him daily. We touched on a lot of subjects, and we'll be posting part of it online. But tonight, we wanted to share with you how he says he's been advocating for changes to how the living conditions standards are met at farms in our region before the pandemic. How have you been advocating for changes in the past?
Well, we've been talking about the change in the living conditions for quite some time because recognizing that, yes, they are a vulnerable group of people coming into Canada with their unique challenges. Health literacy is a big issue. The country that they're coming from, they don't have publicly funded healthcare system. So even seeing a healthcare provider for the first time in Canada, it can be challenging for them. Language barrier is a huge issue for them. Living condition, more and more people living together in a congregate setting, which puts all of them at risk. But also, if you're looking from them from a cultural perspective, they are new here, they are alone. They like to hang out with people who they can associate themselves with, right? Either through work or through their country. So those were their challenges, and we really didn't have much of the tool, but what we have advocated so far is we wanted to have better living conditions for them. And again, when I'm saying better living conditions, you can set up whatever standards you want, but at least try to set up some kind of a minimum standards that what can they expect if they're living and working in an environment which puts them at a higher risk. The basic necessities, if it's available to them, their ability to isolate or to access healthcare system, that's another big major issue. Because of the language barrier, there's not enough physicians or doctors who are taking in these workers as patients. So they end up in the emergency department, even just for some minor aches and pains. So there were a lot of those issues. So what we are trying to work with the federal government and also through our ministry partner is to identify those issues and try to make some systematic changes to support them in these type of situation.
If those divisions, the federal government, the provincial government, had listened to what you had advocated for before, would we have had the summer we did?
Well, it's hard to say, but I think what we know that the major cause of spread is their living condition, because when 1 or 2 people get infected, it pretty much infected the entire housing. Under the federal program, the employers are responsible for housing these people. So we made it clear right from the beginning that you have to have a plan for how would you isolate these people if any of them get sick. But obviously the challenge is that they have that they realize that they don't want to, or either they don't have the ability, some don't have the ability, some don't want to because it's a cost to them, right? So despite our reminders, despite our support, that never happened. So I wouldn't necessarily say that it was just up to the federal government or the provincial government to make those rules. I think the industry on its own, there has to be some standard set up, the standards that is defined right now federally, it's I think that can be strengthened, and that can be very clear directive that this is what the minimum expectation is.
We'll have more of that year-end interview on our website. You can also listen to him tomorrow morning on Windsor Morning, 97.5 FM in Windsor, 91.9 in Leamington. We got some laughter out of him too. Very serious man dealing with a very serious issue, but it was interesting to see how he tries to spend his downtime during all of this as well. Up next, Nick Sirkovich with the weather forecast. Joining us now for a live look at the weather is Nick Sirkovich. Bit of a storm brewing there, bud?
Yeah, you could say that. You know, for those of you that have been watching the weather out in Western Canada, lots of snow. Like, we're talking upwards to 50 centimeters of snow in areas across the BC interior, stretching right across the Prairie provinces. So why am I talking about that? Because it is heading our way. I'm going to show you that in just a moment here. Start with temperatures. 3 degrees right now. It doesn't feel very winter-like. It's actually a little bit above the seasonal mark. Cloud cover for the most part, but what we're watching is this storm that I mentioned. It's this guy. Okay, so it's making its way across the prairies. Underneath this is the warm sector. That's going to move through the region tomorrow, and we're actually going to see a bump in our temperatures for tomorrow. Mainly cloudy skies, sort of mid to late day spotty scattered showers, still in the warm area for tomorrow, and then this thing becomes more of a winter storm for us. It starts as rain for the better part of Thursday. Windsor seeing rainfall as well. Now, Windsor doesn't see much of the transition to snow. If anything, Thursday into Friday, maybe a couple centimeters, but more so out towards, say, the London area, Chatham, Kent. That's where we're expecting to see potentially 10, 15 centimeters of snowfall. It's pretty gusty conditions as well. It actually looks like Windsor kind of gets off pretty good here. We're looking about 3 to 5 millimeters of rain, and then the snowfall actually heavier as you get closer to the London area. It's not showing up on this one here, but I still think Windsor might see a centimeter or two, but that's really about it. So most of that wintry weather actually just to the east of Windsor. However, still got some flurries in the forecast there. There's a look at your 5-day, 8 degrees tomorrow. Temperatures start to dip. Cold start as we get to Christmas Day.
All right, a little bit of hope there for that white Christmas. Thanks,
right.
Nick.
You bet.
Now, last night we told you about the Great Conjunction. If you looked up, you might have been able to see it. The clouds didn't help out. We've got some pictures though. We'll show you next.
Gem.
Stargazers got a very rare treat last night if they were lucky enough to have clear skies. No such luck here. But this is what they were looking at. The solar system's two largest planets, Jupiter and Saturn, appeared to meet in celestial alignment that astronomers, that's a lot of words that are difficult, they call this the Great Conjunction. Now from Earth, the planets appear to be right beside each other. It's something that's not seen in 800 years. That's it for us here at CBC Windsor News. We're going to leave you with something you can see if you take a trip around the neighborhood tonight. But these are some of the best across the country. Another look at the light show in spirit of the holidays.